Welcome to the instructional video on proper care of surgical drains. In this video, you will learn the steps to properly strip and empty your surgical drain at home. First, we will demonstrate stripping the drain using a Tubi vac drain stripper, and then we will demonstrate the procedure using an alcohol pad. Also learn what to watch out for when caring for your surgical drains and what to do should complications arise.
Good morning, Mrs. Smith. I'm here to teach you how to take care of your surgical drain. Do you remember the purpose of your surgical drain?
Yes, it prevents fluid from building up and allows tissue to heal.
That's great, Mrs. Smith. Before we begin, you're going to want to get into a comfortable position and have all of your supplies on hand. You'll need a Tubi drain stripper, an alcohol pad, and a measuring device. It's not necessary for you or your caregiver to wear gloves when you're at home caring for your drain, but you do need to wash your hands thoroughly before and after handling the drain. The Tubi vac is a device used to remove clots and other material that get caught in your surgical drain system. To begin, line up the tubing in the groove of the Tubi vac drain stripper. With your other hand, close to where the tubing exits your body, pinch the drain tubing. Then, to strip the drain, close the Tubi vac drain stripper over the tubing, hold your other hand tightly, and begin to move down the tubing. You can also use an alcohol pad. Again, hold the tubing close to where it exits the body. Wrap the alcohol pad around the drain tubing. Pinch and pull to strip the tubing. You may see and feel fluid moving back and forth through the tubing, and that's completely normal. As you move all the way down the tubing, you're clearing any clots and material from getting caught in your surgical drain system. We always hold the tubing close to the body to prevent unnecessary tugging that can be painful to the patient. Now that you've washed your hands, it is your turn. Please show me how to use the drain stripper and the alcohol pad. Your next step is to empty the drain. You'll need to empty your drain at least 3 times a day or more if needed. Hold your bulb securely in your hands. Take the plug off the top of the bulb and let it expand. You'll dump the JP bulb over the measuring cup and gently squeeze the fluid out. Some fluid may still be left in the bulb, and that's okay. Be careful not to touch where the plug inserts into the bulb or the plug tip itself. After emptying the fluid, squeeze the middle of the bulb and replace the plug while still squeezing. Keep the bulb away from your face while compressing. The bulb should always be compressed like this to work properly.
Each time you empty the bulb, measure the amount and note the color of the fluid. Write it on the JP drain record sheet that you will be given before discharge. If you have more than one drain, keep a separate record for each one. Empty the fluid into the toilet and flush. Rinse your measuring cup and wash your hands with soap and water. Every 24 hours, add up the total amount of fluid you drain from each bulb. You may shower 2 days after surgery. The drain site should be cleaned and redressed daily. Follow your doctor's specific instructions on how to do this. Always secure the drain properly. For showering, hang it around your neck. After showering, you may hang it around your neck or pin it to your clothing.
You said I should empty the drain 3 times a day and when needed. Are there any problems I should be looking out for?
That's a great question.
Potential problems may include all of the following. Any signs of infection. This may include redness at the drain site, an increase in body temperature, a fever, cloudy fluid, or fluid that has a bad odor. You might also develop a hematoma, which is a collection of blood that builds up under the skin close to your surgery site. Treatment depends on the location and the size of the hematoma, but usually involves draining the accumulated blood. Hematomas can be painful and hard to the touch. You may also get a seroma. This is a collection of fluid that may develop at the surgical site after surgery. Usually the seroma is left to heal on its own. The body reabsorbs the fluid and the seroma shrinks. With some patients, the seroma becomes too big for the body to reabsorb and becomes necessary to drain the fluid. If you develop any of these complications, please call the clinic. Their phone number is located on your discharge paperwork.
Can you tell me when your surgical drain will be removed by your nurse or doctor?
It's usually removed when there's 30 cc's, 2 tablespoons or less for 2 straight days in a row. This can happen at first post-op appointment, or it may take up to 3 weeks.
Yes, that's correct. When your surgical drain is removed, you can still shower, but you will not be allowed to soak in a tub or swim until it's okay by your doctor. That old drain site may take a couple days to fully close, and it may ooze a little fluid, and that's all normal. You want to keep that drain site clean and dry. If you notice any swelling, sometimes this is a collection of fluid called a seroma, and that requires medical attention. So you're going to want to contact the clinic office as soon as possible.
If you have had reconstruction, such as tissue expanders or a tram flap, please contact your plastic surgery team first if you have any questions or concerns about your surgical drains, wound care, antibiotic, or pain medications. In this video, you learn the steps to properly care for your surgical drain at home. You also learn the signs and symptoms to watch out for, as well as what to do if complications arise. Your nurse may ask you to repeat the steps you learned on this video to ensure everyone can properly care for your surgical drain at home. This concludes the instructional video on proper care of your surgical drain.